this Obamacare thing, and we've seen just in the last couple of days prior to the taping here, it's coming apart like wet toilet paper. I mean, this thing it's a nightmare, which we always knew it would be.
Absolutely.
And fortunately, the American people are starting to see this. But there's a lot of things about it that people are still not seeing. And you still get in these arguments, people say, well, it doesn't pay for abortion. Well, it absolutely does pay for abortion. Yeah. And it always was going to pay for abortion. And they lied about it when they were back during the
executive order.
Yeah. Right. And these so-called pro-life Democrats bought the lie. They knew they were buying a lie when they did it.
Planned Parenthood approved of that executive order.
Oh, yeah. Right. So, we should roll back the tape and play us saying that the Affordable Health Care Act is the Abortion Bailout Fund.
Right.
We said that 3 years ago.
We said that right here on this show. That's what it was. And now, though, we've got, you still have these people out there saying, no, Obama has assured us it does not pay for abortion, will not pay for abortion. They're lying through their teeth.
And they would not say tapping our phone lines.
They would say that if they came out and explicitly put into the law, this pays for abortion. You still have people coming to us saying, "Oh no, it doesn't pay for abortion." We're dealing with a blinded eye.
Well, we've got somebody joining us now who's done some research on this. Michael New, he's a professor at University of Michigan in Dearborn, Michigan. Hello, Michael.
How you doing, Mark? Good to be here.
Well, thank you for joining us. You're an old long-time war dog in the pro-life battles, and we appreciate what you've done in the past. And you've done some research on this issue.
Yep.
When we say that Obamacare pays for elective abortions, is that true or not true?
It is absolutely true.
Right. Tell us how you know this.
All right. Obamacare pays for abortion in two different ways. There's two separate funding streams it sets up. First is that it subsidizes Medicaid expansion in the states. In many states, low-income earners are able to get health care coverage through Medicaid, and people can decide whether this expansion is a good idea or a bad idea. But the problem that pro-lifers have with it is that in 17 states, abortion is publicly funded through the Medicaid program. In most of these states, courts have ruled that low-income women who are on Medicaid, that the Medicaid program is required to pay for their abortion services. So again, by expanding Medicaid throughout the state, subsidizing the expansion of Medicaid, that's going to mean that more women are going to have their abortion covered, and that's going to mean more abortions. Secondly, as is well known, Obamacare creates these state health insurance exchanges. We've seen the rollout this week, and what's got most of the attention is that the website has been pretty buggy, and the people who'd like to purchase insurance through these exchanges very often have not been able to do so. But again, to help low-income earners buy health insurance, taxpayer dollars are subsidizing some of these insurance programs through the exchanges. And the problem, again, is that some of these health insurance programs that are subsidized by our taxpayer dollars fund abortion. So, again, you have these exchange plans. They're subsidized by our taxpayer dollars, and they cover abortion. So you have the expansion of Medicaid, which results in more public funding for abortion, and you have these subsidized exchange plans that fund abortion. And I'm part of a think tank in Washington, D.C., the Charlotte Lozier Institute. That's the research and education arm of the Susan B. Anthony list, and their analysts have done some research and have concluded that roughly there will be, because of Obamacare, over 100,000 more publicly funded abortions every year. So the exact number is about 115,000 more abortions every year funded by taxpayer dollars because of Obamacare. So it's very clearly there are two separate funding streams. They're going to result in more taxpayer dollars funding abortion, and sadly that's going to result in more abortions.
Michael, correct me if I'm wrong, but isn't there a third funding stream? Health and Human Services Secretary Kathleen Sebelius has mandated that these exchanges have a minimum of a $1 a month surcharge to pay just for abortion. There's not a surcharge for leukemia or heart disease or cancer or something like that, but a $1 surcharge, a minimum $1 surcharge for abortion. How does that work?
Well, essentially, that you're right, Troy. That's another funding stream. I mean, they're trying to make it appear as if that abortion is elective, and those who don't want a plan that covers abortion can opt out. But by and large, money's fungible, and it's just yet another funding stream that's going to be putting more federal dollars into the pot that's going to be subsidizing abortions for women who are seeking them. So you are right. That is another funding stream.
Well, I would argue that, let's say you're in one of the exchanges and you've picked a insurance carrier who does not, that company does not fund abortions. But let's just say that a woman who was elected for that one becomes pregnant and wants that organization to pay for abortions, and they say, well, no, we don't, you chose us and we don't pay for abortions. Because it prohibits discrimination against somebody for pre-existing conditions, she could just drop that insurance company and pick up another one, and instantly they've got to pay for her abortion, right?
I'm pretty sure that's the way it would probably work. Obviously, the details are being fleshed out. Here's another situation that that's not getting much attention. Sometimes it's not clear which of these plans cover abortion and which ones don't. Again, the think tank I work with, Charlotte Lozier Institute, is doing research on the state plans offered to the exchange. They're making phone calls, and very often the people at the other end of the line don't know if these plans cover abortion or not. Or in some cases, they'll hear conflicting things about the same plan. So again, there's a lot of misinformation. I think, again, even the insurance carriers themselves seem pretty confused about whether or not abortion's covered or not. So again, I think it is really clear that there are funding streams out there. They're going to subsidize abortion, and the sad result is going to be there's going to be more abortions as a result of Obamacare.
And you see what's going on here. Those that are radically promoting abortion through the channels of our government, they don't care if people are confused or not. They don't care.
Right.
Yeah, they don't care about. It's not the effort to make people understand. It's the effort to get money into the abortion industry. So if they say, listen, the best way to do this is to make this whole law, first of all, and then all these details, Michael, that you're talking about, the whole purpose is let's make this so confusing that we get that money. As long as we get that money flowing in there, that's all that counts to them.
Well, it's kind of like, you remember in one of the most idiotic statements I've ever heard an adult say in my entire life, Nancy Pelosi saying, we got to pass Obamacare before we can find out what's in it. Remember that? I mean,
Right.
This is the most astonishing statement I've ever heard an adult make in my entire life. It appears now that even once you pass it, you're not going to know what's in it.
No, that's right.
Well, here's a fundamental.
I'm sorry?
There's a lot of truth to that. That's correct.
Right.
So here's a fundamental change. Because of the Hyde Amendment, and this is arguable, but because of the Hyde Amendment, taxpayer dollars were not allowed to directly fund abortion. So they went into Planned Parenthood's general fund for birth control and sex education, et cetera. And as Michael said, it's fungible, so we know that some of that money went to pay for abortion, at least overhead for abortion. But the difference here is we've gone from a passive funding of abortion through the general fund to an active funding of abortion. And make no mistake about it, this is a huge difference. We are now purposely, actively funding child killing. And I think with the surcharge, this is my big deal, it's a direct violation of our freedom of conscience, our freedom of liberties, our religious principles to oppose child killing. Yep. This is a huge change, and as Christians, we must stand against this. For me, this is the red line. This is the line in the sand. I'm not going to participate in anything that actively goes out to fund abortion.
Well, I think the good news is that this thing is collapsing anyway. It's collapsing of its own weight. We found a story about a man named Will Sheehan. Now, he goes on to the website to try to sign up under Obamacare. And he's diabetic, and he chose what he said was the Tier 2 Silver plan. And found out that his monthly premium was going to be $597 a month. Wow. Now, there's a lot of people who pay that much money right now. His deductible, are you ready for this? His deductible, according to the website, was going to be $13,998 a year. So you're getting $13,000 deductible and for $600 a month. Think about that. So he declined. He said, I don't want it. He received an email at 5 p.m. that same day informing him that his fine for declining was going to be $4,037 and could be attached to his next year's monthly income tax return. Wow. So they're going to take the money out. And let me tell you something. I thought I smelled a rat. We talked about it again years ago. When somebody said, well, who's going to administer this program? And the Obama administration said the IRS.
Right.
If red flags didn't go up all over the country with people on that, then and they've hired an additional. Are you ready for this?
Yeah.
16,500 IRS agents.
Armed agents.
Who have access to all your financial records, who can withhold money from your check. They're saying that this man was told that they would even apply a federal tax lien to his home,
right,
if they couldn't recover the fine.
Look, I'll tell you, Mark, Father Frank, you guys are some of my best friends in the whole world. You've never seen my personal income taxes,
right?
And you've seen our corporate ones, and you've never seen my personal health records,
right?
What are the two things that the federal government, that Obama is going to have access to, Kathleen Sebelius is going to have access to? Your personal income tax records and your personal health records.
Absolutely.
And they're going to be able to hang it over your head.
And they can combine them.
And they're going to combine them,
right.
And they're going to say, hey, Mark, if you don't comply with this law, we're going to come after you, your house, your car, your family, everything.
And listen, they went to the extent, this man got an email from them 5 o'clock that day after declining it in the morning, threatening him, saying, okay, that's fine, you don't have to take it.
So even just looking into the plans puts you on their radar.
Don't give them your real name, your real phone number, your real email, nothing.
Wow.
Because these people are going to come after you. They're threatening this guy with a $4,037 fine, and...
But they've arranged their website so that you can't even look at pricing until you give them your personal information,
right,
including your Social Security number. They did that on purpose.
Right.
They have it.
This is scary. It's like we're talking about. We're living in an extraordinarily dangerous time, and people are brain dead to this stuff. But I'm thinking the way this thing is collapsing, they're starting to wake up.
They're going to fix the website. They're going to fix the website. They're going to make it palatable for everybody. They're going to tweak it.
That's
to
not
make
going to solve
everybody
the
happy.
problem.
But the major fundamental problem is at the root. You cannot fix this.
Right.
You cannot fix Obamacare.
What they're fixing the website treats the symptom.
Yeah.
It doesn't treat the disease, and the disease is this outrageous Obamacare thing that everybody knew was a disaster from the beginning. Now even some of the authors of it are saying this is a train wreck. You know, we got to get out of this thing. And you're having all these Democrats back away. And, we're in a position now where we can honestly say, we told you so. We told you this was what was going to happen.
We sure did.
And
Congress is even exempting itself from it, which I think is pretty ironic.
Well, and who is it? Is it Mike Lee that's proposing legislation now that would require Congress to adhere to all the laws that it passes?
I think it was Rand Paul, who proposed an amendment. I think that Senator Vitter of Louisiana has legislation that would require that Congress be part of the Congress and their staff get their health care through Obamacare, through the exchanges.
Well, that may be the very thing that brings it down right there.
Absolutely. I think that's real leverage we have.
Right. Well, thank you, Michael, for joining us. I appreciate the work that you guys are doing.
Thanks for having me. It was fun.
Absolutely.
Thank you, sir.
God bless.
Bye.
Bye-bye.